In Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
With me in the studio now is Professor Malek Başbuş, a Berlin-based psychiatrist whose area of expertise is being happy. What a nice thing to spend your days on. Welcome to the studio. Hello.
Hello.
Happiness is a very individual thing. Is there a general definition of being happy?
No, there are thousands of definitions about the term well-being, happiness, but not a single one on which all scientists can agree. I would say it is a predisposition which guides you through life in an optimistic manner.
Mm-hmm. And there's some kind of short-lived moments of happiness and long-lasting happiness. What are the differences?
You can see the differences on a neurobiological level. So if you look into the brain, what is happening if you have a short-lasting episode of happiness or luck or long-lasting, you see on the one hand, in the short-lasting, that certain neurotransmitters, such as dopamine, are being released. In the long-lasting things, other networks like the prefrontal cortex are being active.
So it's not just in our mind, it's in our bodies as well. And research has shown that happier people are generally healthier people. Why is that?
It is well known that if you're optimistic, if you're happy, that you have a certain degree of healthiness. So you have a reduced risk of cardiovascular diseases, you have a reduced risk of getting skin disorders, a reduced risk of getting depression, obviously. So that has been well observed, and you can track it down to the molecular level. So there are certain molecules which are different in happy people.
And does this affect our life expectancy as well?
Yeah, that's one of the most surprising things. So if you're an optimistic person, you live approximately 8 to 10 years longer. And there are even studies which indicate that making everyone happy would have the same effect like deleting all cancer diseases.
But it's not just a decision to be happy. I mean, if you're a medically person, it's hard for you just to turn the switch and say, from nowadays, I will be happy, or is there a trick?
No, you come on Earth with a certain predisposition, so it's not like that everything is influenced by the environment. But the good news is that you can influence your genes by environmental factors. So the classical example would be people who wear regularly socks in the age between 0 and 3. They will change a gene which is responsible for thermosensitivity, which make them people who are very, very responsive to coldness afterwards.
What role do you think exercise plays in happiness?
It is one road towards happiness. The reason is it is something which brings people into contact, where you do something for yourself and where you force yourself to focus your thoughts on certain things. And all these elements usually make one happy.
Okay. There's an Arabic proverb that says, instead of complaining that the rose bush has thorns, be happy that the thorn bush has roses. Isn't it a nice saying?
Yeah, it's a very nice saying, which shows the basic assumption one has to make that we are surrounded by very positive things, and many of us usually see the negative things and do not focus on positive things, which is one main road towards a very optimistic and well life.
So can we all learn to be happier just by pretending being happy, for instance?
Yeah, there are certain feedback mechanisms. So if you force yourself to do things which you enjoy, you will have positive emotions, and by that you will show that to your surrounding, and then you will get positive feedback from your surrounding, and then you get in a very, very positive circle. The same is true for the negative side too, but it is doable for the positive emotion side too.
But when I go into a bookstore to the self-help books, and I've got the feeling that there's something like a modern compulsion in being happy, and that I need to be happy and that I'm not allowed to be sad. And is it the right thing to live?
No, and even for that, there are a couple of studies which indicate that if you have permanently positive emotion, the decrease of happiness and well-being decreases with increasing number of positive things. So you need from time to time phases where you have negative emotions, where you're melancholic, and being forced to be optimistic is rather something which makes you pessimistic.
Yeah, and when do physicians diagnose depression? So that's not just being a phase of being sad, but it's really a disease.
The very clear criteria, you need a couple of symptoms such as loss of energy, negative mood, and that for a time period for at least 2 weeks, and then one can speak of a depression.
Okay, and then you have to go to a doctor and to treat it.
Yes.
Okay. We got some viewer questions. From Canada, Edinburgh, Primo says she's got a friend and the friend invited her to visit some laughter classes. So it's a group of people who laugh together?
Yes, that might be a way, so nothing for patients, obviously, but for healthy people. And we talked about this positive feedback mechanisms and being surrounded by people, doing something together, listening to positive emotion might induce something in the very depth of your brain.
Okay. And what's your personal tip for being happy? So why are you such a happy person?
You should take from time to time a bird's eye view and do not take things too seriously. So that would be my very simple trick.
And you really can make it through the day with that? So you really do this?
From time to time it's difficult, but I try and it works quite well.
So happiness is a thing you need to train.
Yes.
Okay. Thank you so much for being with us in the studio. Thank you.